Hi, this is Taryn Grome, editor of Pharma Voice. We met with numerous inspirational thought leaders at this year's DIA annual conference as part of our Editors Take video series. I hope you enjoy this discussion.
In this episode, we sit down with Andrew Townshend, Senior VP Alliance Development, INC Research.
What qualities do you look for in a strategic partner? And what factors drive your interest in developing a strategic alliance?
So I think when we're engaging with our potential customers, often the strategic partnerships evolve from a relationship that already exists. And we're looking for companies that have an aligned culture, a discipline in project planning, one that enables us to readily engage with them, to be able to have visibility into the pipeline, which then translates into us being able to resource those projects for them in a much more strategic way and thoughtful way.
What are the key benefits for developing the right partnership and alliance strategy between a CRO and a sponsor?
I think really the key benefits can probably be described in a number of ways. Financially, both from a CRO perspective, these types of partnerships provide a little more predictability in revenue. On the flip side of that, for a pharma company, you're getting that work done at a discounted rate. The ability to be able to have transparency into their portfolio that gives visibility into the work that's coming your way enables you to think a little more carefully about how you resource those studies. And when you look across a portfolio of work, really you're able to then say, okay, how can we maximize the expertise from one project, carrying that into others? And you're moving much more into a focus on either individual compound development or therapeutic development, as opposed to a single study on a tactical engagement where you have very little time for planning, very little time for proper resource engagement. Not saying that it's not done well in that, but you get an enhanced ability to really deliver against that. And I think also in that type of collaboration, there over time you develop a level of trust, transparency, and individuals actually enjoy working with one another. And for folks in a CRO, it feels like you're an extension of that project team within the pharma company, as opposed to you're working on this project today, this project for another company tomorrow.
What is your definition of a strategic partnership?
So I think when you ask somebody to define a strategic partnership, you'll get a different answer from just about everybody. And when you look across the industry at what are termed strategic partnerships right now, quite a few of them are not really much more than preferred provider engagements. Those that really are strategic partnerships have overcome those barriers that are really put up as a result of somewhat tactical outsourcing, without that level of engagement in a common vision, common goals through the relationship, and then the joint planning and execution of trial strategy, operational strategy, financial strategy that spans the entire relationship. I think moving forward as an industry, we have clearly a mix of different company types. We have the biotechs on one end, perhaps with certainly not the size of the portfolio that a mid-size or large pharma company has. They tend to outsource more on a given study, but fewer studies, and tend to do it more tactically one at a time. The bigger companies can go into strategic partnerships with one or two suppliers with a large portfolio, but they tend to give up less of the actual operational aspects associated with a trial, say perhaps protocol development. But I think as we see in the industry, people moving back and forth more readily now between CROs and pharma and CROs, that's definitely changing. and the accountability that's moving on to CROs is growing. And I think that's just a natural evolution of outsourcing.
With the advent of new types of strategic relationships, is the FSP model becoming an outdated outsourcing strategy?
It's a very interesting question. There was a panel here at DIA that I was on that talked about, is the FSP model dead because of the advent of strategic partnerships? Now, my personal opinion on it is I think there always will be a role for functional outsourcing. I think, again, different companies have different philosophies, and I think when you look at an outsourcing strategy, I don't believe there's a right or wrong one. It's really how you manage it within your own organization. Does it fit with the culture of the organization? Does it gel with the way those organizations are set up? And I think there are some functions that naturally fit functionally outsourced model and will continue to do so, pharmacovigilance being a good example. I think one of the challenges in FSP outsourcing is that you are managing a supplier network as opposed to a strategic partnership where you're putting it all on one or two companies and they manage all that for you. So it takes a little bit of that overhead and infrastructure out of that operating model. But at the same time, companies often revert back to, well, I want best in class for my individual function, and I think that will drive for a significant period of time a blend of companies that are in strategic partnerships and in functional models.
For more information on this topic, visit our Thought Leaders website.
For more Editors Take videos from the 2015 DIA Annual Conference, visit www.pharmavoice.com. Thanks for joining us.